So what is bronchiectasis? Bronchiectasis mean dilatation of the bronchi, permanent and irreversible dilatation of the bronchi is known as bronchiectasis. Why dilatation of bronchi occurs? Dilatation of the bronchi can occur as a result of chronic infection or inflammation. Remember that in bronchi, cilia are present. The respiratory mucosa contains cilia, and the function of the cilia is to mobilize the mucus in the respiratory tract so that it can be swallowed in the esophagus and digested in the stomach. So, if any disease, infection, or inflammation, or any disease that blocks the movement of this mucus that is normally produced in the respiratory tract, it will lead to. So, whenever there is blockage to the flow of mucus, what will happen? Bacterial colonization of collected mucus will occur and it will lead to infection, inflammation. Inflammation will further damage the cilia and further obstruction to the flow of mucus will occur. So collection of mucus in the bronchi due to damage to the cilia or any other condition will lead to bacterial colonization of the mucus. It will further damage the cilia and further infection and inflammation will occur. All these things will occur in cyclical fashion and it will lead to destruction of the elastic tissue that are present in the bronchial walls. So when the elastic tissue is destroyed, it will be replaced by the collagen and it will lead to permanent dilatation of the airways. So in short, bronchiectasis is a permanent dilatation of the airways secondary to chronic infection or inflammation. Chronic infection or inflammation can lead to dilatation of the bronchi due to damage to the cilia and elastic tissues that are present in the bronchi. This is known as bronchiectasis. So the cause of bronchiectasis is basically an infection of the respiratory tract. So the causes of bronchiectasis, they include tuberculosis, because tuberculosis is an infection, measles, pertussis, pneumonia. So any of these infections, either due to tuberculosis, measles, or pertussis, or even pneumonia, they all can lead to permanent dilatation of the bronchi, which is known as bronchiectasis. Other things that can cause bronchiectasis, they include cystic fibrosis. In cystic fibrosis, the blockage to the flow of mucus is due to thick mucus that is produced in the cystic fibrosis. So in short, anything that interfere with the movement of the mucus lead to permanent dilatation of the bronchi. So infection, because they damage cilia, so they will interfere with the movement of mucus. Cystic fibrosis will lead to the movement of interfere with the movement of mucus due to a thick mucus production. Similarly, bronchial obstruction due to lung cancer or foreign body can also lead to bronchiectasis. Any immune deficiency will result in the infection of the respiratory tract, such as selective IgA deficiency or hypogammaglobulinemia. So they can also cause bronchiectasis. Allergic bronchopulmonary aspergillosis can also cause bronchiectasis. Genetic disorders in which there is primary ciliary dyskinesia, when the conditions, the genetic condition in which there is genetic problem in the movement of cilia, they will also lead to bronchiectasis. Connective tissue diseases such as rheumatoid arthritis, Sjogren's syndrome, systemic sclerosis, SLE, all of them can lead to bronchiectasis. So in short, we can say that anything that interferes with the movement of the mucus will lead to bronchiectasis or permanent dilatation of the airways. The examples of the condition that can lead to bronchiectasis that you need to remember for Plab 1 exam is that infections such as due to tuberculosis, measles, pertussis, pneumonia, cystic fibrosis, in which thick mucus is produced, bronchial obstruction. Just remember these 3 or 4 conditions as a cause of bronchiectasis. What are the clinical features of bronchiectasis? Remember this one line, that is persistent cough with plurant copious sputum production. Whenever you see this line in Plab 1 exam in any question, you will suspect bronchiectasis. Plurant copious sputum production with persistent cough. This line is specific for bronchiectasis. So someone with a history of a respiratory tract infection or recurrent respiratory tract infection who present to you with